you've had some sort of injury to your brain that wiped out a neurologic circuit. So after a stroke or after damage, after that circuit has kind of been wiped out, what we're trying to do is we're trying to restore a motor circuit. So that means a lot of activities going on in the brain to activate very specific muscles in a very specific sequence that you never really had to think about before, because we just kind of learned these things through normal development and we never really thought about it. And actually a lot of these things we learned before we really started thinking. So there's kind of a small piece of us that just assumes if we just kind of do what we remember doing as a toddler or an infant, or what we see infants do, that's just going to happen. And it doesn't really work that way in an adult brain. So for some of you, not all of you, again, some of you hyper-focus on too much on individualized movement. This is more for those of you that aren't focused enough on individualized movement. So what do I mean by that? You're just forcing it, and either you learn that if you use a little bit of momentum, the arm moves. You don't realize you're doing this, but maybe you're throwing your body in a specific direction and you see your arm move, and so you assume that's a normal movement, but really what you're doing is you're just using kind of like compensatory strategies. But the way that our brains work, you try and do something, you see a habit, you see something happen, meaning your arm moves, and so your brain just kind of reinforces that habit. For a lot of you, that's compensation. And so you force it, and maybe you're using a little bit of momentum, a little bit of compensation, and you see it move. Or you've learned how to trigger spasticity. Now, we're not going to go in depth into spasticity because I've talked about that a lot recently in a whole long series that I did on walking and how spasticity influences a lot of the walking problems that some of you have. But just know that you have learned, or your brain has learned, how to kind of use spasticity to see your hand move, and over time you just reinforce that behavior. So initially maybe your hand was dead or floppy, then you started to get a little bit of spasticity, which is an involuntary muscle contraction of groups of muscles in most cases. In most cases, when it comes to the hand, it's the muscles that grip the hand. So you go from not being able to move your hand to you seeing it grip because spasticity is causing it to close up. You learn how to kind of trigger that involuntary movement, and then that becomes your pattern. The problem with that is spasticity primarily only affects the muscles that close the fist, generally speaking.